Older patients, higher risk, no margin for error. As our population ages, anesthesiologists are seeing more patients over 65 and even over 80 in the OR. What's new? What do the recent guidelines 2023-2025 actually recommend when it comes to geriatric anesthesia? Let's break it down. Why do elderly patients need special attention? Physiology changes, decreased cardiac reserve, decreased renal hepatic clearance, decreased MAC, polypharmacy, and drug interactions, higher risk of post-op cognitive dysfunction, delirium, and falls, more prone to hypothermia, hypotension, and prolonged recovery. So, anesthesia in the elderly isn't just about drugs, it's about strategy, communication, and system-based care. What do the recent guidelines say? Preoperative assessment. Use frailty scales, not just age. Clinical Frailty Scale, CFS, is now widely recommended. Screen for cognitive function, nutritional status, functional independence, social support. Tools like MiniCog or MMSE should be documented pre-op. Choice of anesthesia, general versus regional. Get regional anesthesia preferred when possible. Lower delirium risk, less opioid use, better hemodynamics. But if using sedation during RA, avoid oversedation. Use minimal doses with careful monitoring. For GA, use age-adjusted MAC. Decreases approximately 6% per decade after 40. Avoid benzodiazepines unless absolutely necessary. Consider TIVA with BIS or depth monitoring. 3. Monitoring and intra-op management. Target hemodynamic stability. Even short hypotensive episodes can cause AKI or stroke. Use BIS or depth of anesthesia monitors. Reduces risk of post-op cognitive issues. Avoid anticholinergics, example atropine glycopyrrolate, unless necessary, linked to delirium in elderly. 4. Post-op delirium and cognitive dysfunction, POCD. POCD and delirium are now separate entities. Delirium equals acute, fluctuating. POCD equals delayed cognitive decline over weeks to months. Preventive strategies include early mobilization, family involvement, avoiding sensory deprivation, hearing aids, glasses, opioid-sparing multimodal analgesia. STAR-specific tools being promoted, ACSN-SKU-IP, AGS perioperative guidelines, POPS Model UK, proactive care of older patients undergoing surgery, American Geriatric Society Toolkit for Anesthesia Care. Goal. Final takeaway. Anesthetizing an elderly patient isn't just about lowering the dose. It's about anticipating complications, personalizing care, and preserving quality of life. Start with frailty, not age. Avoid cognitive harm. Use regional where you can. In 2025, the best anesthesia for elderly patients is not just safe. It's smart, subtle, and system-aware.